Hi, everybody. Thank you for being here today. My name is Tehseen Meghji. I'm a naturopathic doctor and birth doula, and today we're going to talk about getting sick well. But before that, just a little bit about me. So, as I said, naturopathic doctor, birth doula. As a naturopathic doctor, I mostly focus on treating the root cause of disease. So, although sometimes naturopathic doctors will look to help with symptom management depending on how acute the symptoms are, our main goal is to always look at what's causing it and treating it from the root. So symptoms could be the branches. The root of the tree is where we look at to have lasting benefit. One of the principles that really speaks true to me about naturopathic medicine is doctor as teacher. So as a naturopathic doctor, for my patients, I always try to empower them about their health. I truly believe that you know your body best, and we work together to make sure that there's lasting benefits and make sure that you know what's going on with your body and with anything that is being prescribed to you as well. My specialties is stress management, digestive health, mind-body medicine. I do a lot of women's health, fertility, and pregnancy as well. So I have 2 locations right here, this beautiful place, our CAC out of the Herbal Clinic and Dispensary. I'm sure a lot of you have been in here before. I do private visits through here as well as the community acupuncture, and I'm here on Fridays and Saturdays. And I do a sliding scale as well for people who don't have insurance, making things more accessible. I do also have a private practice at St. Clarin Avenue, that's Mahia Forest Hill, and I'm there on Mondays. There is lab services and a full dispensary there if you're interested in that as well. I do home visits for births, basically. I provide prenatal care as well as postpartum care, and I attend the birth for women who are interested. It's basically, the picture over there is my first birth ever, and that was in Haiti many, many years ago. But definitely all of them are empowering and growing opportunities for the mom and for me and the family. So one of my big passions. Before we start with the lecture, any questions at all? Okay, perfect. So getting sick well. How many of you have been sick recently? Okay, and how many of you took the flu shot this year? All right. Okay, so we're going to touch on a couple of the things. Of course, mainstream things that everybody might do when they get sick, and also natural alternatives to help with keeping your immunity up. Okay? So I'm going to start with a quote. One that I do like a lot. It says, "Rest time is not waste time. It is economy to gather fresh strength. It's wisdom to take occasional furlough. In the long run, we shall do more by sometimes doing less." So when it comes to making sure you're not getting sick, or if you get sick, basically it's your body's way of telling you that there may be something going on, right? So to take some time, your body may be weak, and that's why it's not able to fight off the infections and the flus. So it actually is a good thing. It's protective for us. It signals that we should slow down and make sure that we're making some changes to rest, recuperate, relax, so we get better soon. So colds and flus are not our enemies, but they're our allies. And it might not seem like it, but basically they get us to slow down a little so we're not getting more serious infections. Okay? It actually helps to increase your immunity and protects against future attacks by the same strains. So when you get sick with the flu or a cold, the strains are changing every year. So if that was to come up again next year, you've built immunity to it. So even if you did get sick, it wouldn't be as strong with the same strain. So if you're having more than 2 a year, this may suggest that you have an immune imbalance or some sort of dysfunction. So looking into that is important, but generally it's healthy to have some colds and flus once in a while. So what's the difference between the flu and the cold? Anybody wondered that before? So couple of things. The flu comes on very, very sudden. So you'll be sitting at your desk or at home and you are fine in the morning, and all of a sudden you'll start feeling bad. Well, the cold will take more time. It's more gradual. You do have more sneezing with the cold, where not as much with the flu. Sore throats and cough. Generally, flus will start with that early on, but same with the common cold, that will be more gradual, getting worse as it prolongs. Muscle aches, definitely more so with the flu. And then fatigue as well, more so with the flu. And this is primarily because the fever is higher with the flu. So the fever is generally higher. With the common cold, it's lower. And the flu generally lasts longer than a cold. Okay. Viral versus bacterial. So we've all seen this before, right? So this is what I think about when I think of a viral infection. The baby with a runny nose. What's the color of the mucus? It's very clear, right? So generally the mucus is clear and white. The discharge is coming out. And that's a primary sign of a viral infection. And usually, sometimes viral infections, if not cleared, can lead to bacterial infections. So it is overlapping, but generally viral infections will start off something like this. In contrast, bacterial infections, you'll have more of a yellow-green discharge. So I know, thank goodness, none of you are eating right now. But that's sort of what it would look like. And some examples are strep throat, bronchitis, pneumonia. You'll see it in the throat, lungs, sinuses more so. So that will give you a good sign on whether it's viral or bacterial. So fevers. Fevers, similar like the colds and flu, are our body's way of naturally raising our set point. So basically increasing our temperature so that we can fight off invaders better. So it's our natural defense for viruses and bacteria, because at a higher temperature, our body is basically programmed to kill off organisms that cannot survive in higher temperatures. So that's what happens. It basically speeds up metabolism to move the blood, oxygen, and nutrients, so these things can reach tissues and dead cells and then basically carry away the pathogens, the viruses, bacteria. Okay, so that's how we usually get a fever. Anything 1 to 3 degrees above normal temperature, which in Celsius is 37.5 degrees Celsius, is actually safe. It's not something that you need to worry about. It may make you feel not like yourself, more fatigued, but it's actually not dangerous to the body and completely okay to have a fever. It supports immunity, and you have a faster recovery time with a fever because your body temperature is higher. So the bacteria, the virus, cannot usually live in that high environment. So a lot of people will use aspirin, Tylenol, Advil to suppress a fever. And although this will happen, your set point will go down, this is going to prolong the infection because now your fever has gone down, so you're feeling better, you're able to do more, but at the same time, we don't have that high temperature to kill things off. So this is going to prolong the duration most of the time. And worst case scenario, if you're not able to fight it off, it can go deeper into the body and cause more serious infections. So what do we do when we have a fever if we're not going to take Advil, Tylenol, aspirin? We want to rest, keep well hydrated, and take tepid baths, so room temperature baths, and that's going to support the fever. Cold clots on the back of the neck, forehead, groin areas. This is where we have a rich amount of lymph nodes, and that's going to help with circulation, and that will help reduce the set point a little bit more naturally, but it's not going to suppress the fever, right? Hydrate with waters, teas, soups, unsweetened coconut water, an excellent electrolyte, and other electrolyte solutions. Lavender oil is excellent. It helps relax, and we use it a lot for children on the feet and the tips of the ears to help them relax and sleep better during a fever. And you may have heard the saying, starve a fever. So that doesn't mean you're not eating anything, but you do want to eat lighter foods and favor clear fluids, only because then there's more energy for your body to fight off the virus or the cold, because it's doing less work to digest or change your metabolism or anything like that. So we want to have clear fluids, eat light, avoid protein-rich meals, and iron as well. So if you are usually taking an iron supplement during an active cold, you might not want to have that, because iron can promote viruses and bacteria to continue to grow. So of course you want to talk to a healthcare professional about this, but that might be something to think about or ask about. So the flu shot, there's quite a bit of controversy over it. You might have heard in the news to have it or not to have it. So I'm going to go through a little bit about why there is a controversy. So flu shot is recommended starting at 6 months of age for everybody, every year for the rest of their lives. So according to the Center for Disease Control and Prevention, the CDC, the flu vaccine has only been 23% effective against the virus. And the reason for this is because the virus mutates every year. So basically, there's different strains every year, and the flu shot is made on the strain that was from the previous year. So if it's mutated, you're protected against last year's strain more so than this year's strain. And viruses do definitely mutate quicker, and we will have different strains every year. And then the British Medical Journal states that the inactivated influenza virus, or vaccine, has modest or no effect in the elderly and children in preventing influenza. So they are finding that it's not as effective. And then the contents of the flu shot. So this is where I get a little bit more concerned with the flu shot. So Fluzone is the one that's the needle, okay? So that's the one that has influenza virus. They grow it in chicken eggs and inactivate it with formaldehyde. So formaldehyde, this is not to scare anyone. These are just the facts. It's important to know what it is, right? To be educated about it. So formaldehyde is what they use to preserve dead bodies. Is also in nail polishes and things like that, and some of the cosmetics that we have. It also contains gelatin, which is added as a stabilizer, and thimerosal, which is a mercury derivative. So mercury is a heavy metal. That may be a problem for some people, as mercury is linked to brain damage and autism recently. So just thinking about that as well. Flu mist is the mist that they put up your nose. They use it for children quite a bit. Very similar, except that this is a live virus. Okay, so because it's in a spray form or liquid form, they use a live virus. It's also grown on eggs and stabilized with sucrose instead, which is sugar, potassium phosphate. And the issue here is that there's MSG in it, right? So we know that MSG is linked to cancer, and we probably may want to be a little concerned if children under 5 are exposed to MSG in that sense. Usually the flu mist is used for children and elderly because they may prefer a spray. It may be easier to administer. This is not to say that you shouldn't have the flu shot. It is definitely a personal decision, and you have to think about where you are. Are you working with healthcare, like in healthcare? Are you exposed to people who are elderly or children who may have lowered immunities? Or yourself, do you have a low immune system, right? And you may get the flu and have that potential side effect of not surviving the flu, right? So it's thinking about from an educational perspective and in an empowerment perspective, knowing what there is and then making that decision. So make an educated decision considering your current and past health status, level of stress, immune function, and possible risk of adverse reactions to the flu shot. Right? Oops. So this is just 2014, 2013. You can look that up on the CDC website, but basically it gives you what the ingredients are in the flu shot. Okay? All right, so what do we do when we get a cold and flu? So a lot of times if you go to a medical doctor, they may prescribe you antibiotics depending on what your symptoms are, what you're feeling. The problem sometimes is that if you have a cold and it's bacterial origin, then antibiotics are going to be effective. However, if you have a virus, antibiotics are not effective against viruses. And sometimes antibiotics are overprescribed for viruses. So they're not effective in that sense. And at the same time, using too much antibiotics is going to kill off the good bacteria in the gut, which is the probiotics. And they can, if you don't finish the course, cause resistant superbugs. So resistant strain of bacteria. So when you actually need the antibiotics, you may not be able to, they may not work as well, right? So at the same time, if you're killing off your good bacteria after the flu or the cold has been eradicated, you can have a lowered immunity, which could lead to more serious infections like strep throat or candida. So keeping that in mind is important. Antibiotics are usually good if you have a serious bacterial infection or a history of recurrent bacterial infections, right? And like we said, you need to definitely finish the entire course so that you decrease the chances of reinfection, even if you start to feel better. And you want to make sure you're taking probiotics to replenish that good bacteria. So as you can see, the only things in this chart that would be cause for bacterial infections that you would need an antibiotic is something like whooping cough, strep throat, urinary tract infections. However, ear infections, sore throats, bronchitis or chest colds, runny nose, and the regular cold, you might not need it. Yes?
So have you treated an ear infection without antibiotics? Because that's the only thing I've ever been given.
For ear infections, yeah. Right? So again, you have to decide if it's a viral or a bacterial cause. And if it's viral, generally increasing the immunity of the child, or if you have an infection, is going to help with treating it. But you don't necessarily need an antibiotic if it is a viral origin. And when they look in your ear, they're able to see whether it's viral or bacterial a lot of the time. Again, if it's bacterial, you're going to see inside the ear purulent, like yellow pus or pus buildup. And that's when you want amoxicillin, usually is what they give. And that's usually what signals that you definitely need to do that. But again, it has to be monitored, right? So from going to viral infections can become bacterial. So making sure it's being monitored, and to avoid recurrence, working on the immunity and building the immunity up so you're not getting recurrent ear infections. Okay. So over the counter, they give us temporary relief. They definitely do work. But again, if they're decreasing the set point or they're stopping things from coming out and being expectorated, they can prolong the risk. You want to make sure that you're making an educated decision and picking something that is good for you, because it can suppress the symptoms without dealing with the underlying causes. So some things people use are decongestants. These are fine. They basically dry out mucus, but once you stop using them, they can have a rebound effect. So you'll get more mucus after. Antihistamines usually used for allergies, but they're not good for colds, and you might find them a lot in over-the-counter medications for colds. And then antitussives, which help with suppressing the cough. And it has something called dextromethorphan in it. And we find this a lot in cough syrups as well. So the thing with cough syrups, they're really high in sugar and additives, some of them. And that can directly suppress the immune system, high sugar, things like that. So again, just reading the labels, making sure that you're making an informed decision of what you have. Expectorants are things that help us cough things up. And that's actually a good thing because it loosens the phlegm and helps things come out, and that's what we want. But sometimes the issue with things over the counter is that with expectorants, there's things mixed up. So there'll be a decongestant and antitussive mixed in combo, and sometimes we don't need those in combination. So just reading and deciding what makes sense for you. as far as naturopathic things or natural things that we can do to boost immunity, I do have a disclaimer on here because I am going to go through a couple of things and recommendations, but this is not medical advice. It's important that you see a healthcare professional, a naturopath, a homeopath, a nutritionist, and work with somebody that, or even your medical doctor, to see if these things are good for you. A lot of times, just because it's natural, it doesn't mean that it's safe for everybody. So making sure that you're consulting a professional, because all these things might not be good for certain diseases that you might have, or for children especially, or in pregnancy. So just taking this with a grain of salt and bringing it up with a healthcare provider, okay? So lifestyle modifications, watch out for stress. So stress is a big thing. When we're stressed out, it decreases our immune response and it will affect our adrenal glands. So this is going to decrease the immune response. A good thing to do is practice deep breathing when we're feeling stressed out, positive thinking, mindfulness, and laughing more so you can sneeze less, right? So basically making sure that you're staying happy, don't worry, be happy, right? And coping with stress in a healthy way. Get enough rest. Try to aim for 7 to 8 hours a night. And the deep sleep is what's important. That helps us with our immunity, and the REM sleep, which is our dreaming state, that also helps release stress and tension, right? Being physically active is also important. So some brisk walking, yoga, muscle training, or swimming are all great exercises to keep the immunity up. Exercise increases circulation in the body, and that's what helps with keeping a strong immune system, because you're keeping things moving within the body. And then what we've heard so many times, so this is how we can prevent viral exposure with good hygiene. So washing your hands for 20 seconds at least is really important. Do not use sanitizer too much, because sanitizer kills off our good bacteria as well. So although it is effective in killing bad bacteria, it's also killing off the good bacteria, which is going to make us more susceptible to infections, okay? So trying to avoid that. Sneeze into a tissue or your elbow. Avoid touching your face. And a lot of people don't realize, but the mucous membranes of the eyes and the nose, you want to try to avoid touching all of that, because that can put a virus or a cold into your system. Clean and disinfect foods and your surfaces, and avoid cross-contamination with raw meats or anything like that. So these are all general ways to avoid getting sick, or if you are feeling that you're about to get sick or feeling something is coming on, foods are also very important in keeping our immunity up. So you want to watch what you're eating, especially when you're feeling a little more stressed out or feeling a cold coming on. So excess sugar, especially refined and processed foods and sugars. Microwave foods, if you're microwaving food a lot, that kills a lot of the nutrients in the food at times, depending on how long it's microwaved. So all those things, GMOs, high-fat diets, they all depress the immune system. So 10%, there's a study that was done that showed 10% of sugar in the diet depresses the immune system by 50%. So that's quite a bit. And you want to avoid cold foods. So this comes from Asian medicine. Cold foods are thought to create dampness in the body. Some examples are dairy, refined sugar as well, soy, bananas, anything that will create dampness in the body. And you want to opt for warm cooked foods, which will be more pleasant to the digestive system and the immune system. Drink up, so make sure you're keeping well hydrated. At least 2 liters of fluid per day, and avoid caffeine, which is a diuretic, so it takes water out of the body, it sucks water out of the body. Favor warm teas and soups. Chicken broth, which was thought of as the Jewish penicillin, because at the time they used to use chicken broth for fighting viruses and bacteria. So broth is really important. I have in your handouts, I have some recipes on how to make broth, some immune boosting broths, so trying that out. You want to use bones of chicken to do that. Chicken is best because it's high in cysteine, which has that antibacterial property and is going to help you fight. But any type of broth, if you're vegetarian, vegetable broth will still be good for you. So it's coconut water and lemon water as well. So here's a bunch of things that are beneficial. Ginger, honey, lemon, onions, garlic, cayenne, turmeric, rosemary, thyme, sage, oregano, and shiitake mushrooms. They all increase the immune system and help with fighting off infections. So definitely looking into that. As far as honey goes, you want to try from Manuka honey or raw honey that has more antibacterial properties. And there's some great Manuka honey lozenges you can usually buy at a health food store. And I find those very soothing to the throat, and they work really well. To keep in mind, though, that honey is not safe for children under the age of 1. And you should keep that in mind. Honey can cause an infection with children under 1. So just keeping that in mind. Ginger honey and lemon tea, very nice when you're sick. Making that up, a batch of that, and you make them in big batches and keep that in the fridge and warm it up over the stove as needed. Works really well. Favoring vitamin C rich foods. So there's a little bit of controversy with vitamin C, whether it actually does anything to prevent colds and flus. So what I've seen is that when vitamin C is taken to bowel tolerance, which means taking it to your individual requirements, that's how you can find out. So your vitamin C levels are going to change quite a bit depending on whether you're sick or whether you're not. And a good way to know what you need, and there is a handout on how to do that as well, is increasing the amount you take every hour, and then wait until you have some loose stool. And when you have some loose stool, of course, you're like, I'm already sick. I don't want loose stool. But once you get loose stool, you bring that down. And you have more of an idea of what your bowel tolerance will be and your vitamin C requirement. When you are done being sick, that will change drastically. So again, it's important to work with a healthcare provider to see what would be best for you. But foods rich in vitamin C, oranges, lemons, grapefruits, which we usually know, citrus foods. But berries, currants, peppers are good as well, and green leafy vegetables, broccoli, cauliflower, and tomatoes. All very good for vitamin C. So there's a bunch of supplements. These are some of the ones that I usually favor for the immune response. Zinc is wonderful. It's good for long-term immunity control, and it reduces symptoms during a cold as well. You can also get zinc lozenges. However, I find supplements of zinc work well, but you need to be careful with zinc. You want to balance it with copper because excess zinc in the body long-term leads to a copper deficiency. So you want to make sure that you're balancing that as well. Probiotics are good bacteria, and those really help with immunity and promote gut health. So our gut is basically our main place for immune health. So if there's issues with the gut and you're not digesting well, your immune system is going to suffer as well. So making sure you have good digestion, good health, and probiotics will help with that. Vitamin C we talked about, it's antimicrobial, antioxidant, and it modulates the stress hormone, which is called cortisol. So making sure you're taking it to bowel tolerance and learning how to do that from a healthcare provider. Vitamin D, also really good for the immune response. It also helps with bone health and mood regulation, so it's really wonderful overall. Vitamin D can be found easily anywhere, but I find that the liquid drops are much better, and you want them to be fat soluble. So how you know it's fat soluble is the drop should be opaque, not clear in color. That being said, if you're using clear drops, it's still going to have benefit, but it won't be as well absorbed as something that is fat soluble, right? So keeping that in mind. NAC is great for lung tissue. So it is a general detoxifier of the body, and it helps with reducing frequency and severity of flu symptoms specifically, and cold symptoms specifically, ones that are affecting the lungs. So it's a good thing to keep in mind. And then vitamin A, E, selenium, and B vitamins, all very good to help prevent infections and support a healthier immune response. So we have like a little cartoon there, probiotics, antibiotics. I think it's sort of cute. And then we have our wonderful herbs. So, of course, the herbal clinic and dispensary can help out with this a little, but some bug-killing herbs. So we have quite a few. Can somebody tell me what the top picture is? Yeah, Echinacea. What about underneath? So that's elderberry. And then the one underneath that, anybody know what that is? Good guess, yeah. So that's andrographis. So I always like to see what the herbs look like. It gives you also an idea of what they might be good for. We have some mushrooms on the other side too, medicinal mushrooms. So echinacea, I'm sure you've all heard about echinacea. It's a powerhouse for immune system. It's antibacterial, antiviral. There's some great sprays that you can get, throat sprays that are echinacea based. Andrographis, right down here, right? It treats the upper respiratory tract infections. Medicinal mushrooms are antiviral, so they're great to have as prevention. So putting those in your foods as well is a good way of doing that. Elderberry stimulates the immune system and it tastes awesome. So we have elderberry as a tea, but we use it a lot with children as well for cough syrups. It's great tasting and really nice when you're sick. Sage sprays, oregano oil. How many of you have tried oregano oil or heard of oregano oil? Great. So it's good. It definitely helps. It's disgusting, yes. But it definitely helps with acute infections when you're sick. But you don't want to take this long term. So it is very strong. So if you're taking it long term, it's going to kill off the good bacteria as well. So you're only wanting to take it when you are sick and you're feeling those symptoms. And that's usually best to do. Astragalus is another great herb for prevention of colds and flus and increasing your immunity. There are research studies that show that it may not be good while you're sick, though, and it may prolong the cold or flu while you're sick. So it's more for prevention. So that's a good thing. Cleavers helps drain the lymph nodes. If you do get like swollen lymph glands or anything like that, that might be something to think about. And Eyebright is good for puffy eyes or any allergic symptoms. Licorice, wonderful antiviral, antibacterial, but you need to be careful if you do have hypertension. It can cause in some people an increase in blood pressure. So being very careful with licorice as well, talking to a healthcare provider. Peppermint, love peppermint. It's calming, cooling, soothing, wonderful, especially when you're sick. Golden seal is the king of the mucous membranes. So it helps with all mucous membranes and is very soothing. A really good immune enhancing herb as well. And then in the olden days, they used to make baths with yarrow. And yarrow, what you can do is actually mix 3 tablespoons in 2 cups of boiling water and add it to a tepid bath, so room temperature bath. And that will help with sweating, circulation, and decreasing inflammation during a fever. So it's pretty awesome that way. Homeopathics, they work on the idea of like cures like. So basically, homeopathy, when you are prescribed a homeopathic, it will be based on the symptoms you're experiencing. So they try to find a remedy that is closest to what you're presenting with at the time. So that's usually the way that they prescribe them. And going to a homeopath or a naturopath, you can try to find out what's good for you. There are a few things that are available over the counter for general cold and flus, but I find finding one that's specific to your symptoms will be more effective. But they sort of look like that. They're little pellets, and you take them under the tongue. So some of the ones over the counter, influenzina and oxalicosinum, it's hard to say. So those ones are ones that I have used in the past, but I do find that getting something that is particular to your symptoms is usually better. Asian medicine. So change of season soup. It's available at the herbal clinic and dispensary in little packs. Has been used for centuries to strengthen the immune system and work with during weather changes. So a lot of times our immune system will take a little bit of a hit during times that the weather changes. So it's really nice to have something that gives you a little bit of immune boost during that time. So they're basically roots of Cotinopsis, astragalus, wild yam, and lychee berry. And these things are put into like a little packet, and you can put them in your chicken broth or just make a broth out of it itself, and have it during times that you may feel a cold is coming on or during weather change, just to give you that immune boost. Usually because it has astragalus in it, you want to avoid having it when you are sick already, but it's great to like build immunity. Protect your wind gate. So the wind gate is the back of the neck. And in Asian medicine, it's believed that that's where external pathogens get in from. So wearing scarves is a good thing when it's cold out. Turtlenecks and warming that area is very good. There's a formula, an Asian medicine formula called Gan Mao Ling. Now it has a lot of herbs in it, and again, it's important to ask if this is good for you, but it's similar in the sense that it has herbs and botanicals in it that are going to help with fighting off a cold or flu, and they're really good for shortening the duration of a cold. And there's a Peepaw Go cough syrup. Tastes amazing. It's naturally sweetened, and it has 15 Asian herbs in a honey base. So I use this one quite a bit. Wonderful. It soothes the throat, gives you good sleep, and it's really yummy. Yeah. And then acupuncture is really excellent to help with increasing immunity. So to relieve sinus infections, or congestion, and just building immunity and decreasing stress, acupuncture does that best. Yeah. So just a video. How many of you have tried the neti pot? How did you feel about it?
Great for allergies.
Yes.
Yeah.
Yes, it's really fun to watch. So generally I like to show what it looks like. It's definitely very good for cleaning the sinuses.
Farms where incredible food grows every day.
Just 4 weeks ago, Amy from Mansville, Texas was here. She asked Dr. Oz about her constant sinus problems and bravely demonstrated what we like to call the nose bidet. Take a look.
That's good. Go slowly. There we are. Perfect.
Feels really good, I swear.
On the other side.
For you, Oprah, I'll do it. Good. All right.
The head down, lean to the side. You're actually very good at this.
That is good.
There you are. Yep.
That is good. And Amy's back with an update. What has happened since that
Okay,
day?
my husband and I use it every day. It's fantastic. I've not had one sinus headache. I haven't spent any money on any cold products. We're loving it. Love it. Highly recommend it.
And you hadn't ever heard of it before that day, or had you?
I had heard about it, but I didn't know if it was something that really works. So, it definitely works.
You know, I tell you, I've gotten complaints from store owners because they can't find them anymore.
Oh, really?
You've all gone out and bought
Yes.
those bidets.
Yeah, so very wonderful. It's like brushing your teeth. Something that you do for your sinuses if you specifically also have issues with sinus infections or find that you do get clogged up quite a bit. It really cleans out the sinuses. You can add things to it too. So you can add some Himalayan salt to it, the pink salt, or probiotics to get an added effect. Some people do put some eucalyptus or golden seal, which is the king of the mucous membranes, right? So that is a mucous membrane area. So you can add things to that as well. We use a lot of hydrotherapy. It's one of my favorite things when people are sick or need an immune boost. Definitely helps with draining the lymph nodes, increasing circulation. So hydrotherapy is wonderful in the case of immune dysfunction. So steam inhalations, Really great to also clear the chest and the sinuses. So it's best to do this first thing in the morning or right before bed, which is usually when the congestion seems to be worse for most people. Add a few drops of your favorite essential oil, but a lot of the times eucalyptus, tea tree, lavender, peppermint are really good for giving you that relief in your chest or your sinuses. So put a couple drops in and breathe deeply. Don't forget to close your eyes, and put a towel over your head and try that out as well. Contrast showers are also really good. So basically, contrast showers are great for lymph drainage. They stimulate the immune response. What you do is you alternate between hot and cold. So when you're taking a shower, if your shower is, say, 10 minutes long, you want to alternate. So you're going to do it in a 3-to-1 ratio. And you want to try to do that 3 times. So you can do 1 minute of hot and 20 seconds of cold, and increase that depending on how long your shower is, but in a 3-to-1 ratio. So you'd be going hot, cold, hot, cold, hot, cold. You always want to end on cold. And it's how hot you can handle and how cold you can handle. Your tolerance will increase depending on how much you do it. So you want to get it as cold as possible and as hot as possible. The change in the temperature, the amount of change in the temperature is going to be what gives you most effectiveness. Always remember to end on cold. Wet warming socks. We use this. I recommend this to moms all the time for their kids, but I use this when I'm sick all the time too. It gives me the best sleep. I have a handout for you on this as well. But wet socks stimulate white blood cell production, it drains lymph nodes, and promotes restful sleep. It reduces fevers and congestion in the head and upper neck and body. So it brings things down, right? So you're going to have less congestion. It's a little bit weird. So what you're going to do, it sounds a little counterintuitive, but you're going to get 2 pairs of socks, 1 thin pair and 1 thick pair. And the thin pair you're going to put in cold water, as cold as you can get it, and wring it out bone dry. So you don't want them to be dripping, but you want them to be cold. You're going to wear those socks on your feet, and then you're going to cover with wool socks or thick socks, and then you're going to go to bed. So it's going to feel wet, but what's going to happen is the body is going to try and bring all the blood down to warm that area up. So it's going to bring things down, and it's going to help reduce fevers and give you that circulation. Try it out. It works really well, and it promotes sleep as well. And then the last thing, humidifiers and nebulizers. So I like a company called Sage Wellness. They're located a couple places around Ontario. They have great nebulizers, looks like that on the side, but you can use a humidifier too. The difference is humidifiers heat up the air, which sometimes can be a little more drying, but nebulizers don't heat up the air. You can put essential oils in both, but basically it's to bring more moisture. So if we have more dryness in our environment, that's going to cause a few little tears in the mucous membranes of the nose, and that can make you more susceptible to getting infections. So having something that gives moisture in the environment is important. It prevents colds and flus in the winter months especially, and nebulizers are awesome. They're great ways to also naturally scent your room as well, and they do that throughout a big space. So very good. So there's some references for you. And basically, if you don't want to take it from me, take it from the minion. Being sick is just your body's way of saying you are too awesome and you need to slow down so everyone else can catch up. Yeah, and if you want a copy of this presentation or you have any further questions, you can email me down there. And get well soon. Thanks. Thanks, guys. Any questions?